the functional anatomy of the shoulder joint. The layer of shoulder joint is three layers. The upper end of humerus, which is an arm bone, and clavicle, which is a collarbone, and the wing blade, which is called a scapula. To understand the stability of the joint, covering the entire circumference of the joint, you have three glenohumeral ligaments in front. Namaskar. Welcome to Vitadell. I am Dr. Gopinath Duraiswamy, clinical lead and senior consultant orthopedic surgeon. I am a surgeon who specializes in complex trauma, arthroscopic and sports medicine, joint preservation and joint replacement surgeries. Today, we will be talking about A to Z about shoulder joint. To start with, let us understand the functional anatomy of the shoulder joint. If you can see, this is a working model, which is a bone model. So let us understand what are the bones forming this joint. This joint is formed by the upper end of humerus, which is an arm bone, and clavicle, which is a collarbone, and the wing blade, which is called a scapula. These three bones come together to form a shoulder joint. The joint as such has a complex and a combination of many movements like forward flexion, abduction, extension, internal rotation, external rotation, and circumduction. Though this joint might be having a lot of complex movements, this joint is a completely unstable joint. To understand the stability of the joint, I'd like to change this model's direction like this. Imagine this model in comparison to a golf ball and a peg. As you've seen, the golf ball is usually 3 times or 4 times bigger than its stand. A small tap on the golf ball is more than enough to push the ball down. Similarly, the humeral head, which articulates with the glenoid, is quite an unstable joint because the humeral head is 3 times bigger than the glenoid. So, the stability of the joint as such is not from the bony architecture but from the surrounding soft tissue structures. To understand much better, let me come back to the same position. So, this shoulder joint is formed by soft tissue stabilizers. The layer of shoulder joint is 3 layers. The first layer is going to be your glenohumeral ligament. That means ligaments or soft tissue structures which attaches between the glenoid and the humerus. So imagine your fingers. There's a big head over here which articulates a small articular surface or the glenoid bone. For stability purpose, these fingers should clasp around the head, holding these 2 bones together. So this is the function of a glenohumeral ligament. You have 3 glenohumeral ligaments in front, which is superior glenohumeral ligament, middle glenohumeral ligament, and inferior glenohumeral ligament. These 3 ligaments will prevent the forward translation or the forward movement of the humeral head away from the glenoid. And on top of it, you have a thick covering called the capsule, like any other joint, covering the entire circumference of the joint. This will create a second layer of restraint or preventing a dislocation or bizarre movement across the shoulder joint, adding to the stability. The third layer of the shoulder joint is called the rotator cuff, which is responsible for the varied movements of the shoulder joint like forward flexion, abduction, external rotation, internal rotation, and circumduction. These rotator cuff muscles are responsible for the entire movement of shoulder joint. So, on total, you have totally 3 layers of soft tissue protectors giving stability to the joint as well as movement to the joint. Apart from this, the outer covering is your muscles, big muscles like the deltoid, which gives bulkiness to the joint and also strength to the joint. To understand better, we let all 3 structures have to combine together to give stability to the joint. Thank you.